Hi everyone, Amir Sadri here from Specialists in Plastic Surgery. I'm here with my colleague Paul Harris, who's our expert on breast surgery, and we're talking about breast cancer and breast augmentation. Now, patients, when they want to have breast augmentation, are worried about breast cancer. What's your experience?
Well, there's a lot of confusion about breast implants and breast cancer.
Okay.
There is no link between breast implants and breast cancer, and it's important to state that.
Okay.
There has been a recently discovered cancer called ALCL, which is an immune type of cancer. It's very, very rare, and it's been linked to some types of breast implants. However, of course, breast cancer is much more common, 1 in 8 patients, and there is no link between breast implants and breast cancer. Indeed, I go further than that and say that actually if you have breast implants, there's a slightly reduced risk of breast cancer.
Why is that?
It's probably related to the population that we're looking at, but probably not a direct link. It's probably related because patients are slightly thinner, they have a lower BMI, and that reduces their risk. They're also much more breast aware, so they're examining their breasts, and any problems they go and seek attention early.
Okay. Now, we were looking at this paper that's just come out in this month's Plastic Reconstructive Surgery Journal, and it's a paper from Chicago, and they were looking at the immune response and breast cancer. What did we learn from this paper?
Okay, so as I said, we think the reduced breast cancer risk in breast augmentation patients is because of the population. Okay, what this paper is looking at is saying, is there a direct benefit, if you like, from having breast implants? Can that reduce your breast cancer risk?
Okay.
And what they're surmising is, or what they're putting forward, is that all foreign bodies, including breast implants, they promote or stimulate an immune response. Okay, that's your white blood cells, your T cells, your B cells, and antibodies. And what they're sort of suggesting is perhaps there's some cross-reactivity, so that by mounting an immune response to the breast implant, you might also stimulate an immune response to a breast cancer. And we understand that a lot of cancers now are about immune surveillance. So some cancers come about, your immune system fights them off. And perhaps if you have a stimulated immune system, you're fighting off more breast cancers, and therefore your breast cancer risk might be reduced.
But this is all a might, because there's two things about this paper. One, that it's a very early study, and the other thing that is that it's an industry-sponsored paper, which means that a breast implant company has sponsored this article. What does that mean?
Well, of course, I think you're right. It's a very early study, and it's really the first study that's looked at this direct possible benefit from breast implants. But breast implant companies, they're on the back foot at the moment because of this ALCL, this other immune cancer. And what they're trying to show, I think, is to sort of say, well, look, overall your cancer risk might be reduced because of the benefits of breast implants. And of course, because this is paid for directly by the implant company, then the people doing the research, they have a vested interest in giving the answer that the breast implant companies are looking for.
Right.
So we must be skeptical.
So what would you advise patients regarding cancer and breast augmentation?
Well, it's really important that they have the discussion with their surgeon, and their surgeon must be qualified, must understand this, must talk about family history, must talk about the risk moving forward, and must tell patients about breast implant surveillance. So you must examine your breast moving forward, you must have regular scans, including mammograms, particularly if you're in screening age.
Thank you.